Assalamualaikum and welcome to the platform of Pharmacokinetics once again with a new video of the drug series that is Diclofenac. As you can know, Diclofenac is available in the potassium and sodium form both. This is the Analgesic series and Diclofenac is in the Analgesic series. So let's begin the video. Diclofenac sodium is NSAID, that is a non-steroidal anti-inflammatory drug, and its chemical classification, it lies in the phenylacetic acid group. It inhibits the COX-2 pathway specifically. Diclofenac is basically the analgesic antipyretic. That means it is used in the fever because it regulates the body temperature and maintain the body temperature. It is also having the anti-inflammatory action because obviously NSAID having three properties, that is analgesic, antipyretic, anti-inflammatory, and in some drugs antiplatelet activity like we discussed in the topic of aspirin. Efficacy is similar to the naproxen. It inhibits the PG synthesis, somewhat COX-2 selective. It reduces the neutrophil chemostasis and reduce the superoxide generation. No antiplatelet action because that belong to the COX-1 agent. Now the pharmacokinetic profile of the Diclofenac. In the pharmacokinetic profile, we obviously discuss the absorption, distribution, and elimination of the drug. Absorption, it is well absorbed and undergoes the first pass metabolism. Only 50 to 60% of the dose reaches the systemic circulation. Why? Because of the first pass metabolism, and its peak plasma concentration usually attained within 1 hour. Its onset in the single dose 50 or 100 mg doses of Diclofenac potassium provide pain relief within 30 minutes. While if we are talking about its duration of action, it lasts up to the 8 hours following the administration of a single 50 to 100 mg doses of the Diclofenac sodium. Food delay the time to reach the peak plasma concentration but do not affect the extent of the absorption following administration as conventional delayed release or extended release tablets. So what is the distribution pattern of this drug? Its plasma protein binding is greater than 99% and extent following oral administration. Concentration in synovial fluid may exceed those in plasma. Now, after the metabolism, absorption, here is the phase of the elimination. Metabolism, it is metabolized in the liver as I described by the first pass metabolism. Why? The hydroxylation and conjugation mechanism. Some metabolites may exhibit anti-inflammatory activity. Elimination route, it is excreted in the urine and the feces, and here you can see the percentages. Now if we are talking about the half-life, different preparations having the different half-lives. Like in the case of the oral preparation, its half-life is 1 to 2 hours. Diclofenac epolamine transdermal system, and its half-life is approximately 12 hours. Now if we are talking about the pharmacodynamic profile, that include the pharmacology, mechanism of action, and adverse reaction. If you can see here, the basic pharmacology as I described previously, it having the analgesic, antipyretic, and anti-inflammatory activities. Why? Because it inhibits the COX-2 pathway. Diclofenac is used to treat the pain. Why it is used to treat the pain? Because it is analgesic in nature. It have different anti-inflammatory properties. Why it having the anti-inflammatory properties? Because it inhibits the COX-2 pathway, that is a COX pathway. It inhibits the enzyme COX-2. That's why there is a no PGs. So when there is no PGs, there is no pain and no inflammation. So it is used in the ocular inflammation, osteoarthritis, rheumatoid arthritis, and spondylitis. If you still didn't see the NSAID mechanism in my previous video, so first go and check out these. Now mechanism of action, obviously action by inhibition of the prostaglandin synthesis by inhibition of the COX pathway, that is the cyclooxygenase enzyme. inhibiting the cyclooxygenase enzyme and COX pathway. Prostaglandin endoperoxide synthesis, PDG, is also known as a cyclooxygenase, is a key enzyme in the prostaglandin biosynthesis. Now, what are the adverse drug reaction? In the previous video, we discussed the common adverse drug reaction. So, in the class of the NSAIDs, some common adverse effects are upset stomach, nausea, heartburn, diarrhea, constipation, gas, there is a flatulence, headache, drowsiness, and dizziness, because it having the CNS effect also. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Kinetics of the different dosage form, because different dosage form have the different absorption pattern, different bioavailability, protein binding. So these are some pharmacokinetics of the different dosage form of this generic, that is Diclofenac. So here you can see the EC tablets, suppositories, sustained release tablets, and injection, and these having the different pharmacokinetic profiles. Now Voltaren dosage, ideally daily doses, 150 mg long-term therapy, 75 to 100 mg daily in 2 to 3 fractional doses, or 1 daily. Starting dose, that must be the loading dose, 100 to 150 mg daily. In milder cases, 75 to 100 mg daily. 99% plasma bound, because it is highly protein bounded, so its half-life is 2 hours. Good tissue and synovial fluid penetration. Most widely drug used in the rheumatoid arthritis and all these inflammatory conditions, as I described in the previous slides. So this is basically the summary. Risk of the heart attack and the stroke increases when we use the Diclofenac, because obviously it is NSAID. So that's all from this drug and from this video.